Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next topic is routes of replacement of esophagus. The routes of replacement of esophagus are of four types. For esophageal replacement, we can replace the esophagus either through the posterior mediastinum, or we can replace the esophagus through the anterior mediastinum in the retrosternal position, that is behind the sternum, from behind the sternum through the anterior mediastinal route. We can replace the esophagus through the lateral transpleural placement. Also, we can replace the esophagus through anterothoracic or pre-sternal subcutaneous route also can be used for replacement of esophagus. But what is important among all these, posterior mediastinal route is the shortest route, and it is the most preferred route for replacement of esophagus with conduits.
thank you and thank you for watching.